You will need the prescribed medication, medication chart, a sterile syringe between 3 to 5 mils, sterile needles 21 gauge to 23 gauge, alcohol swab, dry swab, a forceps, a receiver, disposable gloves, sharps container, and a clinical waste bin. Hello, my name is Joanne Nathan. I'm a third year medical student from IMU. Can I have your full name, please?
I'm calling Kim, but you can call me May.
I see. Miss May, can I know how old are you?
19.
You're 19, yeah? Alright, Miss May. I'm going to give you an injection. It's called diclofenac sodium. It's for your migraine. Alright? I'm going to give it to you on your buttock. You may feel a bit of pain, like an ant bite, but I'll be as gentle as possible. Can I proceed? You just hold on for a while I go and prepare the medicine. Alright? Ensure you follow the 6 R's. Right patient, right drug, right dose, right route of administration, right time, and right documentation to ensure correct administration of drugs. Wash hands to prevent transmission of microorganisms. Don a pair of disposable gloves. Check the expiry date of the syringe and the needle. Remove the syringe from the packaging. Do not touch the nozzle to prevent contamination. Remove the needle from the packaging. Attach the needle to the syringe. First, check if the medication has expired. Never use medication that is cloudy or discolored. If unsure, contact the pharmacist. If you have powdered drugs, reconstitute it according to instructions. Remove the medication cap. Remove the needle cap from the needle. Dilute the medication according to instruction. Make sure all crystals have been dissolved in the solution. Warm the vial by rolling it between your palm to help the drug dissolve faster. Wipe the top of the vial of medication with an alcohol swab. Remove the needle cap from the needle by pulling it straight off. Pull back on the syringe plunger to draw up an amount of air equal to the amount of medication needed. In this case, Miss May will receive 1 ml of diclofenac sodium injection. Holding the vial in an upright position, insert the needle straight into the center of the rubber stopper in the vial. Then, push the plunger to discard all the air into the vial. With the needle in the vial, turn the vial upside down and hold it in one hand. The tip of the needle should be within the solution. Pull the plunger back in a slow, continuous motion until you have drawn into the syringe the amount of medication needed. If air bubbles have formed in the syringe, dislodge them by gently tapping the syringe with your free hand while continuing to hold the syringe and vial in the inverted position. Double check to make sure you have correct amount of medication in the syringe. Remove the needle from the vial. Pull back the plunger slightly and discard the needle. Change to a new needle. Push the plunger slowly until a small droplet of medication is noted at the bevel. Miss May, I'm going to give you your injection now. Before that, let me double check your details, yeah? Can I have your hand, please? Go Lei Kim, 19 years old, medical record number 000250. Alright, Miss May. I will need you to turn to the side for me to give you your injections. Alright? Provide privacy and expose the injection site. Ensure you have a chaperone. Ensure you remain gloved to reduce contact with blood. Ensure you place all the medication and equipment on the injection trolley. Do not place anything on the patient's bed. Locate the injection site. Identify the greater trochanter and the posterior superior iliac spine. Draw an imaginary line between the greater trochanter and the posterior superior iliac spine. The injection is given in the upper outer quadrant. Prepare the injection site by cleaning the area with an alcohol swab using friction in a circular motion. Wait for a few seconds until the alcohol has dried. Remove the needle cap from the needle by pulling it straight off and hold the syringe as you would hold a pencil using your dominant hand. Spread the skin at the injection site using your non-dominant hand to minimize discomfort. Insert the needle using a quick smooth motion at a 90-degree angle. As soon as the needle is in place, move the non-dominant hand to hold the lower end of the syringe. Slide the dominant hand to the top of the plunger. Aspirate by slowly pulling back on the plunger and observing for blood. This is to determine whether the needle is in a blood vessel. Discard the needle and inject another site if blood is aspirated. Discomfort and possibly a serious reaction may occur if drug intended for intramuscular use is injected into a blood vessel. If no blood is noted, inject the medication slowly. Slide back the dominant hand to the lower end of the syringe. Use the non-dominant hand to spread the skin at the injection site. Remove the needle quickly in the same direction as on insertion because slow removal of needle pulls the tissue and may cause discomfort. Apply gentle pressure on the injection site. Do not massage the injection site. You may note a drop of blood, but there is no cause for concern. Cover the patient and assist to a comfortable position. To avoid needle prick injury, never recap used needles. Discard them in the sharps bin. Discard the alcohol swab, dry gauze, and gloves into the clinical waste bin. Wash your hands. Document the administration accurately to prevent medication error. Evaluate the patient's response to the medication within an appropriate time frame, usually between 15 to 30 minutes after injection. Thank you, Ms. May. I will come back to check on you later.